All right, ladies, listen up. This is a common question that you have. I know because I see it all the time. I hear it all the time in my office, and that is, if I start on hormones, am I going to experience side effects like breast tenderness, or am I going to get bloated? Because I definitely don't want to do that. I'd rather go without hormones than to have those side effects. So let me kind of explain why that sometimes happens, and also explain what can we do to try to offset those symptoms so that you don't experience those side effects. One of the main reasons it happens that I see in my patient population in particular is in postmenopausal women. So postmenopausal women, they've gone through menopause, and often they've gone at least a couple years where maybe their symptoms haven't been bad enough to where they've sought treatment. And so they've gone 2 to 3 years with no hormones in their system, essentially, right? And so the initiation of hormones often will bring on those side effects if we're too aggressive with the dosage. So that's something to be aware of. So how do we offset those symptoms? You start at a low dose and you titrate the dose slowly. So oftentimes I will have a conversation with my patient that says something like this: listen, I know you've got a laundry list of symptoms. So we've made our assessment. We've got 5, 6, 7, 8 things that we're trying to accomplish here and to improve on. But you have to have the expectation that's realistic, because it may take us 3, 4 months to really get your levels where we need them to be so that the symptoms have resolved. But if I try to resolve your symptoms in 3 weeks, you're going to be calling me and you're going to say, hey, I'm bloated, I've gained 5 pounds, I can't wear a bra, and I'm not doing this anymore. So we start with a low dose and we titrate slowly. I generally start with a really, really low dose. If I'm using an oral, I'll start with something like 0.5 milligrams of estradiol, and I'll have the patient use that for about 4 weeks, and then we'll increase that dose slightly. And we'll do that for another 4 weeks, and then we'll increase it again. And we'll keep titrating that dose up until we see the lab values that we're looking for and also the symptom relief. So it's important to know that the initiation of hormone therapy for women, especially in the postmenopausal state, has to be done in a slow, gradual process so that you get the benefits, but you don't have the side effects. I hope that's helpful. If you've got any questions, please feel free to reach out to me. You can email me at info@optimizehealthnow.com, or you can go on the website at optimizehealthnow.com.